Hi, my name is Dr. David Lowe. I'm an associate professor and consultant in paediatric respiratory medicine. And as a clinical academic, what this means is that I not only get to care for children directly on a one-to-one level within the hospital or outpatient setting, but also conduct research to try to improve how we care for children with breathing illnesses more widely. In my clinical practice, I see children and young people from birth to 18 years with a variety of different respiratory presentations, including asthma and wheezing, chronic cough, frequent chest infections, but really any unexplained chestness or breathing concerns. Regardless of why a child is brought to my clinic though, my aim is always to get to the root cause of concern by making a holistic assessment of a child or young person presentation, which always includes a detailed history and examination, but may also include additional investigations like blood or lung function tests and imaging to make a diagnosis, recommend appropriate evidence-based treatment, or simply to provide information and to reassure. Children get coughs and colds. It's an unfortunate but normal part of growing up. Some children, though, do seem to be coughing or snotty all the time, and that can be worrying for parents and families. So most of these episodes, as I'm sure you've been told, will be caused by common cold viruses and will get better on their own without antibiotics. In fact, in younger children, it can be normal to have up to 12 viral respiratory infections per year. And when each of these can take a couple of weeks to improve, it may feel like your child is unwell all of the time. So when should you be worried? Well, if despite these episodes, your child is growing and developing normally, they get better between each of these episodes without needing antibiotics, and they have some longer periods, particularly over warmer months when they are completely well, then they're very unlikely to have a more serious underlying cause of these illnesses. And things will almost certainly improve as they get older, as they develop immunity and build tolerance to some of the common respiratory viruses that they come across. If, on the other hand, your child is needing frequent antibiotics, their symptoms never completely go away, or each of these episodes were so severe that they need to be cared for in hospital, then it's definitely worth speaking with your doctor for an assessment or referral to a specialist. It's just a bit of wheeze, they'll grow out of it, or we can't diagnose asthma in children under 5 years old. These are some of the frustrations that I hear often from parents and families when they've brought their child for help who has wheezing or breathlessness often. And of course, I understand why parents are told this. Wheezing, by which I mean a whistling noise when a child breathes out, is really common in children younger than 5, and usually due to chaotic airflow when there is swelling to the airways as part of a viral chest infection, which is why you may hear some doctors call this viral wheeze. However, in children who get wheezing a lot, either with every cough and cold they get, or even when they are well, running around like crazy with their friends and family, or if they struggle to breathe so much so when they wheeze that they end up in hospital more than once, then it's possible they may have asthma or some other breathing condition. And whilst it's true that very young children are not usually able to do breathing tests to confirm asthma, an experienced clinician, after taking a detailed history and perhaps performing some blood tests, can usually make an informed judgment as to whether a child's symptoms are likely to be due to asthma or not, and to initiate a trial of appropriate treatment for asthma, even in very young children. So whenever we see children with breathing concerns in clinic, we always ask how they're developing and how they're growing. And the reason for that is because, generally speaking, if a child is thriving, if they're growing well, if they're developing normally, they're very unlikely, even if they have frequent respiratory symptoms, to have anything serious underlying wrong with them. And the reason for that is because children who have a serious underlying respiratory problem, such as a chronic or long-term infection, or they have difficulty breathing a lot of time, then their body uses a lot of energy to cope with either that infection or to breathe, so much so that they do not grow and they do not thrive as we expect them to. So the reason we ask this question over and over again is because actually it's a really good screening test as a respiratory clinician to find out whether a child is likely to have anything serious wrong with them, or that this is likely to be fairly benign and they're going to grow out of it.